Hi, my name is Cecile Chang, and thank you for joining this month's Conversations with Dr. Levin-Scherz, where we ask Dr. Jeff about COVID-19 and other clinical topics that are on the minds of employers, with a special focus on what employers can do to respond and prepare. So welcome, Dr. Jeff. How are you today?
Hi, Cecile. So nice to see you.
So can you first start us off with where are we now? And I've heard a rumor that getting COVID is no worse than the flu. Could you please provide your thoughts on that?
Sure. So first of all, we're in a much better place than we were when we had this conversation a month ago. So I think 49 states are reporting a decrease in number of cases of COVID. Hospitalizations are down by a quarter to a third. There are very few counties at this point that don't have enough ICU capacity, as opposed to a month ago when there was a substantial portion of the country in that situation. So the Omicron wave has clearly crested and it's on the way down. That's good. We're continuing to have a very high number of deaths and a much higher number of deaths considering the number of cases or considering our population than most other developed countries, including developed countries that have had pretty severe Omicron waves. And that's likely because even though we got off to a decent start, we are under-vaccinated compared to most of Europe and compared to most other wealthy developed countries. So yeah, I've heard this from a number of analysts as well, that COVID is nothing worse than the flu, and I think that you have to think about it like for many individuals that's totally true. So I know more people that have gotten COVID over the last 2 months than I knew for the entire rest of the pandemic, and few of them have needed to see doctors. Few of them have been sick for a long time. And at least so far, not many of them have had long COVID. But again, time will tell. We'll have to see about that. I think the problem is that COVID has now become a different disease for vaccinated people than for unvaccinated people. And so for people who are unvaccinated, COVID is way more likely to lead to hospitalization, being in the ICU, or dying than influenza is. For people who are vaccinated, not quite as much, but remember there's still 3 or 5 or more percent of the population that's immunocompromised. We don't know for sure whether the vaccine has worked adequately for them. So I'd say we're not at a point as society where we should consider COVID just like the flu. But I do think that for people who are fully vaccinated, who've already been boosted, people can start doing things again because it is safer, and the rate of community transmission is going to keep on going down over the next month too.
Right. Well, you actually tee up my next question then, which is I agree with you. A lot of people have gotten COVID in the past couple of months. For those who have gotten COVID, should they be getting vaccinated as well?
Absolutely. So we know that people gain some degree of immunity from infection. We know that people gain some degree of immunity from vaccination. In general, most of the studies show that vaccination gives people a better, more immunity than simply getting an infection. There is at least one study that shows the opposite. But again, if you also look, all the people that had infections, they're counted amongst the unvaccinated when we look at rates of hospitalization, ICU stay, and death. And rates of death in unvaccinated people compared to boosted people, they're often 50 times higher. Again, that's including all the people, which is a lot at this point, who've had infections. So the vaccine gives people who have good immune systems a reliable amount of immunity, and that seems to be longer lasting than from infections. Again, for individuals, it'll probably be different, but for populations, it makes sense for us to recommend the vaccine for everybody. And unfortunately, there's not a blood test right now that can tell somebody who had an infection whether they've got enough antibodies that they could avoid a vaccine. Can I also mention, because the vaccine is so safe, the harm of having the vaccine is low to none, whereas the harm of leaving yourself a little bit more vulnerable or a lot more vulnerable could be very large.
Right. So then similar to the vaccine question is a question about boosters and, how How should employers be orienting around boosters with respect to any vaccine mandates that they might be considering?
Yeah. So basically, I mean, for an individual, the value of having a booster is really high. So the value of having, two shots for, initial primary series in preventing hospitalization is very high. But then, then getting boosted makes it substantially better. Generally, depends upon age and stuff, but generally it decreases your risk of hospitalization by another factor of 3 beyond having the first two shots. So individuals should choose to get boosters. It's a complicated question for employers. It's much harder administratively to mandate boosters because everybody's not eligible for a booster at the same time, and it requires much more tracking. I think that employers have a limited amount of bandwidth. Many of them will choose to mostly focus that on people getting the first two shots, not a third shot. Some employers are, especially in finance, in finance and technology, and in higher education, and in healthcare, are mandating third shots. And again, especially in healthcare, that makes really good sense. But I think that there are choices to be made, and it would be great for everybody to be boosted, but getting everybody the first two shots is the most important thing for employers, and it's easier.
Got it. You brought this up in one of your earlier answers, long COVID. So we're seeing some data emerge around the prevalence of long COVID. How should employers be orienting around it?
Well, Cecile, it's a really important question. And, there are a lot of studies out there that suggest that the prevalence of long COVID is quite high. The methodology of some of them is a little bit rough. It's, you just sort of check with people 12 weeks afterwards. And if they have any symptoms, then they have long COVID. The problem is if the symptom is depression or anxiety or insomnia, a lot of other people have it too. But we know this is a real thing. We know that it's causing a substantial amount of absence and disability. There's one set of researchers who think that about 15% of the unfilled jobs in the US are not filled because of people not in the workforce because of long COVID. So again, all the more reason to get everybody vaccinated. And I think one of the other things is employers need to be very sensitive to avoiding stigmatizing people who have long COVID. It's tough when somebody says, "Oh, I have brain fog." There's not a blood test for it. It's harder to prove it. It's harder, frankly, to get disability benefits from disability insurers too. And I think employers have to be sensitive to this issue and also have to be ready to make some accommodations for people with long COVID.
Mm-hmm. Well, that's good advice. Thank you. I'd like to bring in a non-COVID question, if I may.
I would love to talk about something other than COVID. Absolutely.
There is a myriad of topics that we could talk about in the clinical and health realm that don't have anything to do with COVID. And it's a question that I've heard bubbled up a few times over the past couple of months. So there are new blood tests, new technologies that can use genetic analysis to detect early cancer. And I'm curious, should employers be thinking about incorporating this technology into their healthcare offerings?
Well, for starters, this is really promising technology. I mean, there's perhaps a day, someday, we are definitely not there yet, where instead of people getting mammograms and people getting colonoscopies, people can just have a blood test couple times a year, and if there are fragments of cancer detected in the blood, then they can have more tests. And maybe then we would also be able to find hard to screen cancers like pancreatic cancer and ovarian cancer early enough where we could cure people, as opposed to late enough that that even though we have good treatments now, people will end up ultimately dying of the disease. So I think this is really promising. What employers should know right now is that none of these tests are FDA approved. None of these tests are recommended for screening. There's no long-term study that even shows these tests make people less likely to die prematurely of cancer. So if an employer offers these, they should expect their medical costs to go up because some of these will be positive and people will need a bunch more tests as a result, and they might need therapy too. And then the test and the therapy they'll need will be now as opposed to in 2 years or 3 years or 5 years. I think it's likely that these will be shown at some point to be able to prolong or save lives. But on the other hand, That's what I think, but the data is not in yet. So I think most employers should be watching this very carefully, and should be very cautious if a prospective vendor suggests that this will save them money. They should be very cautious in evaluating that.
Okay, so promising, and let's wait and see.
That's what I'd say. Yes.
So anything that you want to wrap us up with today, Dr. Jeff?
Well, I was struck earlier today with a quote from an epidemiologist at the London School of Hygiene and Tropical Medicine, who was talking about the U.S. vaccine coverage and the fact that we have such a higher level of death and hospitalization than most other developed countries, as I mentioned earlier. And here's a quote from him: "The U.S. has fewer layers of protection from prior infection, vaccination and boosters added together, than a lot of European countries. That's why the U.S. is headed in a different direction." So I think that we've talked a lot over these last months about the importance of vaccination, and I think that we're now seeing the natural experiment of the U.S. with lower rates compared to other countries. And again, that's reason why we should continue to strongly encourage vaccines, especially also knowing that now that the Omicron wave is on the downswing, there's a decent chance we will have other waves. Hopefully they will not be more severe disease, but getting that background immunity level up is really important for public health.
Yeah, I read a similar article that said the downswing in Omicron is our window of opportunity to get our vaccination-based immunity up higher as a population. So totally agree with that.
Yep.
Well, as always, thanks so much for your insights and suggestions to employers on how to navigate this ever-changing world. And we will see you next month.
Great. Thanks very much, Cecile.